The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally.
Hello, everyone, and welcome to another episode of Supplementing Health. I'm really excited because today we have a really exciting guest who's going to talk about something I am seeing more and more of in my practice, and I think is incredibly important. So we have Michelle Routhenstein, who is a cardiology dietitian, registered dietitian nutritionist, and certified diabetes educator, specializing in heart disease management and prevention. And she's also authored a cookbook titled True Easy Heart Healthy Cookbook. So welcome to our podcast, Michelle. Thank you so much for being here.
Thank you for having me. I'm excited to have our conversation.
Yeah, and I think it's so timely, given that this is also Heart Health Awareness Month, and there seems to be a lot of campaigns around heart health. But what I'm finding my patients especially are asking for, and I'm sure you see this a lot in your practice as well, is this desire to have access to tools so that they can actually implement some of these heart healthy choices. So a lot of times, sometimes they may know better, but it's about accessing tools to do better. So what kind of tools, I mean, obviously you have your cookbook, what kind of tools are you finding and creating to help individuals live heart healthy lives?
I think it's a great question. I find that a lot of times when it comes to heart health, many people are hyper focused on all the foods they shouldn't be eating for their cardiovascular function. While it should be quite the opposite. There's a lot of foods that our body needs in order for blood flow to be optimized, in order for the heart to beat regularly, in order for cholesterol to actually be excreted properly from the arteries. So I really reframe it as, what foods are we currently eating? Oftentimes people will say to me, what's the best heart healthy diet? And they want me to tell them the Mediterranean diet, the portfolio diet, the vegan diet, which one's the best? And I hesitate with that because there's so many interpretations to each, and you can be a heart healthy vegan, but you can also be an unheart healthy vegan. So to categorize it by everyone should just be on this one diet is not very helpful. I find that the importance is we need to take the science and their personal lifestyle and preferences and merge them together, because this is a lifestyle change. This isn't a diet you do for a couple months to see results and then go on your merry way, because heart disease is a progressive disease. We need to be able to implement change forever in order to really optimize our blood vessel health and prevent heart attacks, strokes, and cardiovascular disease.
Thank you so much for saying that, because I do find oftentimes, leaders in this industry will pick one specific diet and they tend to kind of speak to that only. And I love that you're highlighting the complexity and ensuring that something is sustainable for a patient means that you are taking their lifestyle into account. Now, I would love to delve in a little bit more specifically on each of those factors that you talked about. So healthy blood vessel flow, healthy cholesterol excretion. If you could break down what it actually means to be heart healthy. What does a healthy heart look like?
Yeah. So I think from my perspective, being in the cardiology space, it is that many people, well, oftentimes when people first talk to me, they say, Michelle, I don't understand how I had a heart attack. I don't understand how I have plaque in my arteries or why my blood pressure is high. Like I eat healthy. And I think, everyone's definition of what healthy is hard to identify or to really quantify, is that truly healthy? And the difference when it comes to heart health is that we are really addressing your blood vessel. So when you have high cholesterol or when your LDL starts to increase, it's a sign that there can be extra cholesterol in the arteries. And when that's coupled with inflammation and oxidative stress, it leads to that LDL to become oxidized, which leads to plaque formation. And plaque formation is not something that you just get overnight. It happens over years and decades depending on your genetics. So we've seen it in kids as young as 8 years old, and we've seen it significantly in 14 and 15-year-olds, but it doesn't present itself until later because it takes a while for it to completely block the entire artery. So when we look at heart health, we're really looking at making sure that the blood is flowing properly. Your blood pressure is normalized, 120 over 80, but we've even seen in the research 110 over 70 is kind of that ideal standpoint. We also can look at pulse pressure. We can also look at your cholesterol levels. And, there's this wide range of, well, what's normal? And it's important we assess the genetic risk factors and all your risk factors to really know what's normal, because we've seen in the research that LDL should actually be less than 70 and not less than 100 in people who are at an increased risk. And so really taking it one step further to optimize all of these values can give us an indication that blood is pumping thoroughly throughout the body, your heart is beating regularly, and you feel energized, productive, and you feel really good. It is a lot of signs. And I have to always say this because I don't think it's talked about enough. Your bowel health, your gut health is so important. So if you're constipated or you're not having good, effective bowel movements, there's a likely chance that things are getting stuck in the arteries and not being excreted the way that it should be. So those are some signs that I look for when I'm evaluating my clients.
Yeah, and I think you've touched on a few really important points. I would love to get more insight into what kind of risk calculators or insights are you using? You touched on genetic insights for patients to help frame what that risk means, because I find sometimes with patients, you do need to explore and explain why something not happening 10 years from now is important to start making those changes today, right?
Right. So my clients are usually people who have already high risk that's been identified, whether it's a family history, an elevated CAC score, a high LPA, high blood pressure, high cholesterol, fatty liver disease, or a cardiovascular event or a bypass surgery. So my clientele is already in the cardiology space. So I don't necessarily use the Framingham study or the MESA studies. I look at it more of a thorough evaluation of assessing for insulin resistance, inflammation, gut issues, and doing a comprehensive laboratory analysis of seeing where those numbers are and how we can optimize them.
And do you have any advice for patients who maybe are just starting to explore their heart health in terms of advocating for some of that additional testing? Is that something they should do early on, or are you finding that they can do that later?
So I unfortunately find that a lot of people just don't know what to ask for. They don't know what to look for. And so a big part of it is having that conversation with your physician, but knowing going in kind of, well, how do I assess for these things? So I give my clients a list of the laboratory parameters I like to see. And usually I collaborate with cardiologists that I work with privately, but I also can collaborate and have with my clients, physicians, to make sure that we're doing a proper analysis. One of those things that I do recommend is that lipoprotein A. It tells us a little bit about the inherited risk for atherosclerosis. And so a lot of people who have premature heart attacks, they don't really have any other big signs that they are susceptible to an early cardiovascular event. But when we dig deeper into it, their LPA levels were crazy high. And if that was taken into account at an earlier age, they could have been more proactive and been a little bit more looking into it from an early prevention standpoint. So I do recommend that everyone, whether you have cardiovascular disease or you don't, that you know your lipoprotein A level, that you don't just let the doctor say, everything looks fine, I'll see you next year. You get a copy of your lab reports and you assess it, especially year to year, to see your trends. Because many times, a lot of people are already on a statin when they have a cardiovascular event. And so when I look at their lab trends, their LDL went up 20 points in that year before their heart attack. And that could have been a point that things were going the wrong direction. So being an advocate of knowing your numbers and really assessing it, and not just like taking the advice of, oh, everything's okay, being more at that forefront is really important.
Yeah, and I often find in practice I'm highlighting ratios. So, not just the static numbers, as you said, looking over time, how things are changing and also how they're changing in relation to each other. So, you mentioned with LDL levels. On the flip side, it's also really important to improve HDL levels. Can you kind of speak to your experience with HDL and how that's an indicator or something that we can improve and how that impacts heart health overall?
Yeah, so HDL is looked at as a very big antioxidant. It helps to kind of also take some of the LDL and make it a little bit more protective, because it helps with decreasing the production of it in your liver. And so we want HDL to be high. We want it to be above 60. We've seen some recent studies that show we don't want it to be extremely high, so that 60 to 70, 80 is kind of our sweet spot of where we're looking for, but it is a protective agent. But I always want to emphasize that, because I hear a lot of people anecdotally say, well, I have a really high HDL, but that doesn't mean that your LDL shouldn't be dismissed. And we need to look at the ratio and each one of them by itself, but we do want to get your LDL to a lower amount too, irregardless of the HDL as well. And we can do that through nutrition, and primarily physical activity is influenced more with your HDL, and your LDL is more influenced with nutrition.
And can you speak to some of those influences? How do we start lowering our LDL?
Yeah, so LDL, it's not just one thing. Many things can increase our LDL. It can be insulin resistance. So if we have excess blood sugars in our blood vessels, that can increase our LDL. If we're having too much saturated fat, too much trans fats, we want to make sure that we have a gauge on that. It's not necessarily in avoidance completely, but we do want to have a certain amount of grams per day depending on the individual. And then we also want to make sure that we have enough soluble fiber in the diet in order to grab the LDL and excrete it. But that's a very simple way of looking at it. If there's inflammation, our bodies can't grab the cholesterol. If there is insulin resistance, if there's oxidative stress, or if there's any gut issues, we can't excrete it properly. So while that's a very easy way to look at it, we need to look at all of the other components and make sure they have a check mark to make sure we're getting the LDL out. And I always say, you're not going to take a blood test every day to tell if the LDL is coming down. But if you have good, effective bowel movements, that's where we're going to excrete a lot of that cholesterol. And so getting to that point daily is vital.
Yes, it's amazing how much people have normalized not having a daily bowel movement, and they'll come into practice and I'm like, oh my goodness, no, let's get that moving. How do we start influencing and improving that? How do you do that in practice?
Yeah, so we have to kind of assess if there are certain triggers in the gut. So if someone has acid reflux that's not controlled or that's being controlled only with like a protein pump inhibitor, we need to address the acid reflux. If the person has bloating or constipation or any indigestion, then we need to address that too. We need to also assess, how is their microflora? Are they consuming the probiotics and prebiotics in the right quantities to allow for a good gut health. But we do everything very slowly depending on where they are. So it really depends on the individual, but we want to make sure that we are addressing all aspects of digestion. I think it's also important to note the meal timing and meal patterns that somebody is having, because that's going to influence the ability for your body to metabolize the food that you consume. So we have to look at kind of the whole picture of and analyze it. It's interesting because nutrition has many people have become mindless with nutrition, that they don't realize the reactions to certain foods. Or they might say, oh, I'm bloated all the time. But when we actually dive in, we really see patterns, and we're able to identify certain triggers that cause them to get indigestion. So a lot of it is, let's hone in and see what's going on so then we can address it appropriately.
And you've mentioned some of the diets, you kind of talked about Mediterranean, portfolio, keto, a vegan. What aspects of each of those is ideal? Like, what parts of those diets do make them optimal for heart health?
That's an interesting question. I guess I would say, if I had to choose, the portfolio diet really emphasizes the soluble fiber and the plant sterols, which are helpful in lowering cholesterol. But like I mentioned before, I don't know if I actually mentioned this, but when we are talking about blood vessel health and somebody has high cholesterol, if it's not addressed appropriately, it can actually lead to high blood pressure, because if the arteries are getting clogged with that cholesterol material, it can cause that vasoconstriction, and that can lead to high blood pressure. So the soluble fiber and the plant sterols are great for lowering cholesterol, but they might not address other issues that are happening in the blood vessel. So those are two great aspects, but it's not necessarily enough from a blood vessel optimization standpoint. When it comes to the Mediterranean diet, they really emphasize the balance of having lean protein and having your fruits and vegetables and your whole grains. And that aspect is really advantageous from a macronutrient balance standpoint. I think a lot of times people get a little confused because the Mediterranean is so wide and vast, and so they kind of pick and choose what they want to consume from it. So they're like, oh, well, in the Mediterranean, we eat all of these high-fat cheeses. Why don't we do that? Or we grill all the time. So there's certain aspects that can still lead to inflammation in the arteries, and so we need to be cautious with some of those principles or what we hand select. The keto diet, I don't know if I can say, it depends how you look at it. If you're looking at a traditional keto diet, it's mostly fat. And there's no way to have a high fat diet that's not going to cause accumulation of fat in the arteries and the liver, unless you're choosing a keto Mediterranean diet where it's more of the heart healthier fats. But I still, from a cardiovascular standpoint, we can't overdo fat consumption, even if it's heart healthy fats, because it still can lead to that fatty deposits and triglycerides to increase in our arteries. So vegan diet, it depends how you look at it. If you look at it from a traditional standpoint, having a plant-forward diet is very advantageous for heart health. Right now, though, it's kind of a trendy thing to do. So clients will send me like, look, I found this vegan restaurant and I found all these vegan ice creams and cheeses. And if you look at it, the first ingredient is coconut oil. And coconut oil has the same amount of saturated fat as butter. So you have to look at it together in the sense of, well, is it really heart healthy just because it's not an animal product? Not really, because you still can have a lot of saturated fat, which will clog your arteries. So it depends. So I like the plant forwardness from that aspect, but you can also be eating all processed foods on a vegan diet. So we need to be careful with that as well.
I love that you say plant forward. It really highlights and emphasizes that it's, plants are emphasized and kind of at the forefront, but not the only thing. Because yeah, you're right. I keep seeing all these highly processed meat alternatives that are plant-based. But when you really look down to it, it doesn't really have as much plants. It doesn't have that balance of the antioxidants, the flavonoids, the fibers that we require. You also spoke to the coconut fats. Can you kind of speak to the different oils and fats for cooking, and how someone can delineate and choose the best fat for them?
Yeah, so I like avocado oil for cooking oil because it is has a high smoke point. What that means is when it goes on to heat, it doesn't change its form. So the oil remains a monounsaturated oil, which is cardiovascularly healthy. And so you don't have to worry about the heat temperature, even though from a cardiovascular standpoint, we want to avoid dry, high temperature cooking because it can lead to advanced glycation end products to form, which can cause inflammation in the blood vessel. So avocado oil is my preferred cooking oil. And then when I'm using cold preparation or very, very low heat, extra virgin cold pressed olive oil is a really great oil as well because of the high concentration of polyphenols in it. Those antioxidants are very potent, but we see in the research that when they are exposed to heat, a lot of them get destroyed. And so we want to keep them intact as much as possible. So using them on a salad or in a dip that you're creating, or as like a topping for flavor topping on top of your meal, that's what I would prefer.
Excellent. Now, of course, the topic of the podcast is supplementing health. So in bringing in the aspect of supplementation, a lot of key antioxidants or active ingredients within these, rich foods like polyphenols in red wine, for example, are being extracted, and there seems to be a growing movement in the supplement industry for high dose antioxidants or flavonoids. What is the role, would you say, for supplementation in a complete heart healthy diet?
I feel like this is such a common question, and it's so hard to give a blanket, like everyone who has heart disease or wants to prevent it should have this supplement, because supplements are exactly that, a supplement. It supplements your diet. And so from my perspective, we need to make sure that you're trying to get all of these nutrients through food. And if you can't, and we see that there is a struggle or there is an underlying issue or you're on certain medications that deplete certain nutrients, we can rely on supplements. But I use it kind of as that, well, what do we need? What is going on that we can't necessarily get from food that we need a boost of? And then making sure that it's a quality supplement. I think that when it comes to supplements, we really need to make sure that we're not buying into a lot of the marketing, because a lot of supplements are in toxic doses that our body can't recognize or process, and it can cause issues in the kidneys and the liver. So we need to be super aware of that. And I also say, always contact your healthcare provider team, because when I provide a supplement, I'm making sure that there are no fillers, emulsifiers, or things that's actually going to cause inflammation in the arteries, because there's so many of them in the supplemental industry and it's not regulated. So we need to be super cautious around that too.
Yeah, absolutely. I think it's you hit the nail on the head when you said it is meant to be supplemental, and those that rely only on supplements for that, I think are missing that opportunity to have a whole foods approach, which is in balanced doses as nature kind of intended. That seems to be all the time we have today, but I thank you so much, because I think it's so important to start with a individualized approach to heart health and with a complete understanding of context. And you've provided a lot of that for our listeners. So thank you so much for your insights today.
Thank you for having me.
Where can listeners find you?
You can find me on Instagram at heart.health.nutritionist. You can also find me on my webpage at entirelynourished.com.
Yeah, and like I said, check out some of those cookbooks. Just some great material and lots of information there. So thank you again, and we will talk to everyone next week.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca.